Tests like colonoscopy. When you get your colonoscopy exam, your gastroenterologist looks into the colon, sees whether there's anything there, and if there's any potential cancer starting early, they can take it out. So it's a one-stop approach to screening and prevention. Screening for average breast cancer screening for average risk women should start at what age? Yearly mammogram. Well, it's 45. Currently 40 and recommended by the American Cancer Society. And again, this is because we're seeing lots and lots of new cancer cases in young women. For instance, last year, 25% of the cancer cases that were diagnosed in women were in women under the age of 50. This is compared to maybe like 10 to 15% in previous decades. So a woman, an average, is so encouraged to start getting your annual mammogram by the age of 40. For instance, women are starting girls are starting their periods much earlier now. We've seen that 1 year delay in starting the age of menarche or menstrual period increases the risk of breast cancer by 10%. So the earlier a woman starts a menstrual period, the higher her risk of cancer. Women are, the earlier a woman starts or a girl starts her period, the higher her risk of developing breast cancer. Mental factors and exposure potentially to, this work is still ongoing, so I don't want it to be gospel truth. Exposure to things like bisphosphenol, which are in plastics. Again, this is accumulated exposure. If few exposures will not increase risk, but disruptions affects when girls start their cycle. So those are things that we need to.
What disruption? You know, now my business mind. Him and you to find out whether you can come up with something that will delay menstrual period, so that I can use that resource to tell kids that if it comes later, then you are at risk of getting cancelled. Because I think that's what drives us crazy sometimes. It's not
food. Now with the food here, it's things that I don't know.
Specific
ultra processed foods.
Processed foods.
Or ultra processed. Yeah.
What about specifically home?
That's increasing there. We also know that if a woman delays her first child till, well, let me put it in a more protective way. Having a first child before the age of 30 reduces a woman's risk of developing breast cancer. Again, because of things that we need to do, these are societal changes that we are all going through. Women are delaying their first childbirth till after 30, and all those things have cumulatively impact risk of breast cancer. So these are all the factors that are contributing to us seeing breast cancer rising, especially in younger women.
I like the many children better.
We call it the triple negative breast cancer. But we've seen that breastfeeding practices differs by race. In the United States, black women are less likely to breastfeed, and when they do, they're less likely to breastfeed for as long as white women. So again, that impacts their risk of developing the aggressive type of breast cancer. First smoke cigarettes needs to be screened for lung cancer at age 50. Anyone. I think the thing here is to think of is anyone. So the answer here is false, because it should be anyone who has smoked more than 20 cigarettes a day. So one are surest way to damage the cells in one's body. Unwillingly. Who discovered that? Either from family history of prostate cancer or certain other health conditions, you need to talk to your physician and doctor on what the best time to do that is. Because again, screening for prostate cancer, currently we do it using a test called prostate-specific antigen. It's not very sensitive. It picks up cancer, but it also picks up other things. So the question is, if the PSA levels are high, what does that mean? So you have to start thinking, okay, well, am I ready to go through the potential workup for prostate cancer based on this PSA test with its potential complications? Or I guess for a lot of people, exercise is not just going to the gym and lifting weight. 30 minutes 30 to 45 minutes of active walking every day counts as exercise. You can do this with your family. Go to the park with your kids. Spend 30 minutes just walking around the park. That counts as exercise. Don't smoke or use smokeless tobacco. Eat healthy diets. Make fruits and vegetables part of every meal. Fruits and vegetables reduce your risk of developing cancer. Choose fish, chicken, or beans instead of bread and processed meats. And also just cut back on ultra-processed food and foods that are bought in the stores. Limit alcohol. If you can do it, 0 is best. But again, having a glass of wine occasionally is okay. Again, what matters is moderation. Sun and against avoid tanning beds. Again, this is more for our white colleagues, but again, we also know that as black people, we also at higher risk of, we also can also develop skin cancer. So protect yourself, and that's one thing I don't do very well, but I'm trying to do that now. Anytime I go out during the sun, especially on vitamin D, and consider a multivitamin with folate. If you cannot get all the nutrients from your diet, the ideal thing is to get all your nutrients from diet, but if you cannot, consider using a multivitamin with a folate.